Welcome to Ask the Pediatrician, and of course, we are glad that you could join us today. Quite hot in Lusaka, and I'm sure that where you are, it's extremely hot. Though some signs of rain this afternoon, later on, due to the heat and so on and so forth. But hopefully that your weekend is going well. Now, today we are back to discuss common skin problems in children. Common skin problems in children, and our specific focus will be on 3, though we might actually touch on others as well. But obviously we might want to look at scabies, ringworms, and of course eczema as well. Just how do they affect the health of a child? In the studio with me, I'm joined by Dr. Ngalamika, who is a dermatologist, who is going to help us really take a look at the 3 in details. Dr. Ngalamika, welcome to our discussion. Thank you so much for coming.
Thank you very much.
I'm glad that you could join us today. And of course, to all our viewers joining us for the first time, this is the program specifically that discusses the health of children. And when we are talking about a child, we are obviously talking about from 0 to about obviously 17 years of age and so on and so forth. So all the questions should be in line with the health of a child as well. For contributions, you'll be coming through on the number that will be rolling on your screens. You can ask any question that you have, and of course Dr. Ngalamika will be able to discuss to obviously share expert knowledge in relation to that. But remember that this platform is not a diagnosing platform. It's not a platform where we diagnose different diseases. We are here to provide information, but the information that we provide here only directs you to go and see your health experts for further for further remedies, especially where treatment is concerned. So when we discuss here, we are not saying go into a drugstore and get medication, but what we are saying is that go to your hospital and get treated right there. First things first, what are some of the common diseases that really affect the health of the child, especially in relation to skin conditions?
Okay, some of the common skin conditions that we see in children include some of those that you've mentioned: eczema, scabies. Then there is also the ringworms. Then we have vitiligo, which is also quite common. And then there is also other conditions: bacterial infections, viral infections on the skin, and other forms of fungal infections besides those that are called ringworms.
What causes some of these skin conditions in a baby or in a child?
Okay, so we can address them one by one. So we can start with eczema, which is pretty common. So eczema is a skin condition with a high predisposition to allergies. So it's not an allergic condition, but it's an inherent skin condition. So what happens is individuals with eczema, they will usually have dry skin, and they'll have flaring up of the condition in winter months when the humidity is low. So most of the time there is this protein that's been found to be deficient or in these individuals. It's called filaggrin. Mm-hmm. And it helps to retain moisture in the skin. So with reduced or no amounts of this protein, individuals tend to lose more moisture. The skin dries up, it cracks a bit, then it itches. When they scratch, the rash comes out. So it's
that is in eczema.
In eczema.
Okay.
So
how common is eczema here in Africa, Zambia to be specific?
Mm-hmm. It's quite common. I wouldn't say the actual incidence rate or prevalence rate, but it's among the conditions that we see very often. Though the presentations differ in babies, they'll present a bit differently from older children.
Okay.
Yeah.
If we were to talk about the appearance of eczema, how does it look like?
Okay. So in the early stages, so there's different stages. There's acute stages and more chronic forms. So in the early stages, you find reddish areas on the skin which kind of ooze Okay, so they produce fluid, and so there'll be like moist areas, and then they'll be itchy, and when that fluid kind of dries up, it forms these crusts. So you have these itchy areas which are red, and they kind of discharge some fluids.
Okay.
And then in the more chronic forms, when someone has had it for a long time with scratching and all that, you find a more thickened skin, darkened maybe, and with increased skin markings and a dry scaling, like shedding of skin.
Interesting. So what are some of the symptoms that might indicate that this is eczema?
Okay, some of the symptoms and signs. So the patient will note that they'll have an itchy area before the rash actually comes out. So, and then even when the rash comes out, the rash will be quite very itchy. There are some conditions of the skin that don't itch, but this eczema is characterized by itching. So it will be itching, and then when you look at it, if it's in a child, in an infant, younger children, like babies for instance, they will have lesions mostly in certain areas, maybe the face or the knees, the elbows, because this is the area where they are most prone to friction, or where the hands can reach, because usually the rash will come out after the scratching. Okay. So the baby will easily reach the face, they'll scratch, and the rash will be in those areas. In children, older children, it's usually in the antecubital fossa, which is just the flexural part of the elbow, not the behind, the front part of the elbow. And then on the legs, it will be, on the lower limbs, it will be behind the knees, that part. So you have rash in those areas, most likely is eczema.
Okay, yeah. Interesting.
And then in adults, anyway, we are discussing children. So
interesting.
Yeah.
Let's come to the other skin problem that you mentioned, ringworms. Obviously, ringworms is quite common. And something interesting about Zambian environment is that it seems like every child has to pass through that age where they will have ringworms, viscera, and something like that. Is it that every child at a certain age they will have to suffer from that, or maybe there is what we call specifics?
Okay. So before I go into the details, most of the time when someone develops ringworms, most people think it's actually worms in the skin, but it's not worms, it's just a misnomer. It's actually a fungal infection of the skin. So it's called ringworm because it forms a ring. So the rash will start at a place, then it will start developing. It will clear on the middle, the skin will be normal, then it will be expanding on the side, so it will form a ring kind of pattern. That's why it's called a ringworm. Now, it's not every child that goes through that. Some are more predisposed to developing ringworms than others, and commonly in children it will occur in the scalp, and they will develop these areas, patches. These are flat lesions that will be scaling with white scale and itching as well. So in most cases when a child presents like that, more than 90% of the chance it should be a fungal infection, it should be a ringworm. But we do some tests to just confirm.
What's the difference between a ringworm and a fungal infection?
A ringworm is a fungal infection. It's just called ringworm because of this is just a term that's been used for a very long time because of the pattern of the rash. However, it's a fungal infection. There are many types of fungal infections. So the ringworms fall under the infections called dermatophytes. So the dermatophytes affect the very superficial part of the skin. So the skin has layers. So dermatophytes affect the epidermal layer, and the topmost layers of the skin. And It's like that because they feed on keratin. Keratin is the substance protein that's found in the cells of the epidermis. So usually that would be the presentation.
Interesting. And which age groups seem to be more prone to ringworms and of course fungal infections?
Okay, so the ringworms, you have school age going children because exposure to from other children, so they usually transmit this around. So mostly the school age children are more.
So it's contagious.
Yes, it is, but not doesn't mean everyone who gets in contact will get it, but it is through contact.
Okay.
Yeah.
Okay, interesting. In line with whether it's contagious or not, I might also want to find out if at all it has got anything, these skin diseases that you have mentioned, the two, eczema and of course ringworm, even before we come to the third, if at all they have anything to do with the DNA. Are they genetic, or they just come about?
Like for instance, the first eczema, I mentioned a protein that's reduced. So there's a gene called filaggrin gene. It's not in every eczema patient, but most cases they'll have a defect in filaggrin gene, which like certain mutations which reduce production of a certain of the protein filaggrin, that now leads to increased water loss from the skin. The skin tends to dry up because of that reduced production of that protein. So that one is, their genes is genetically kind of determined. However, for the fungal infections, there is no specific genes per se, but obviously certain people are more prone to fungal infections. Some get them more often because of inherent defects, genetic as well, which may predispose them to fungal infection because the immune system can't easily clear these infections.
Let us come to scabies. What are scabies?
So scabies is an infestation with a mite called Sarcoptes scabies. So this mite kind of penetrates into the skin and forms these burrows, and it's a very itchy condition, and usually the mites will affect areas that of the body that are like closed up, like maybe in the webs of the toes or finger webs, or in the wrists, areas like that. And the mite tends to feed in the night, so you find that individuals will present with, they say the itching is worse at night. They have itching during the day, but itching is worse at night. Then they may also have, the genitals may also be affected by this mite.
When you talk about scabies, that is the condition that is commonly known as mpele in our local language, right?
Mm-hmm. Yes.
Exactly. I know possibly you touched on that particular part, but why is it that they are quite common in between the fingers? It seems like, they tend to infest the hands more than other parts of the body.
It's the environment. It's the environment. They prefer those maybe humid, closed up places where they can hide, and so it's just about environment. Similar to fungal infections, they'll be more common in moist and humid environments or times of the year, and they'll affect moist and humid places at certain times because they tend to grow better, feed better. So the mites also prefer those areas because they are closed up, and they tend to hide there. Yeah.
When we were growing up, obviously we were fed with stories such as, it depends on the region where you are. For example, you'd find that in Copperbelt, it's quite common. Mpele is very, very common in Copperbelt. Kitwe, to be specific. I grew up in Kitwe, so I could see some of my friends had them, and I think some from my family also developed. But here in Osaka, they don't seem to be so common. I don't know whether it's true that they are usually regional, infections, or maybe they can affect anybody regardless of where they are?
It can be anywhere, and it's just the environment sometimes plays a role. So they'll be more common in maybe areas where there is poor hygiene or increased this congestion of people living in a small environment, and also certain times of the year like the winter months when people less to have less hygiene because of the weather. So it's more cold, they'll wash less, maybe bath less, and things like that. So it can be anywhere. It's common in Lusaka as well, but obviously probably there are certain times of the year when it's more common than other times.
How contagious are they? Are they contagious really?
Usually transmission through direct contact. Like I mentioned, those people who live in it closed up, many people in one environment, they tend to transmit at a higher frequency because it's through direct contact. So someone has to be in contact with someone with scabies for a couple of minutes, maybe 20 minutes, for them to transmit, for the mite to move from one person to the other, or sharing certain fomites, beddings and stuff like that. So it's through prolonged contact. Actually, it's transmissible, but through long contact.
When you look at the three skin conditions common in children that you have highlighted, scabies, ringworms, and of course eczema, which one seem to be more complicated, might cause further complications, more serious, more dangerous in a child?
Usually they are not complicated. Usually it's just focused in the skin. However, eczema, if it's very severe, because it might be severe and affect a big part of the body, and someone can get infection through that because the skin integrity is impaired. So there can be a focus of bacterial infection, which can lead to sepsis, to septicemia, and then it can lead to much more serious problems. However, generally, if it's very localized, few lesions, it's usually manageable and it's not much of a problem. So eczema would be that. Scabies as well, because of the nature of the lesions, they tend to be very itchy. So someone will scratch very hard, and those can be a focus of infection because they are peeling the skin off, and the bacteria can go through and also reach the bloodstream and cause a much more serious infection.
When we look at the diagnosis of these skin conditions, how is it done?
So usually for eczema, it's usually a clinical diagnosis. So from the history and how the patient presents, when we look at the lesions, we diagnose based on how it's a clinical diagnosis. We don't really do tests. The only test we may do is eczema patients may tend to also have lots of allergies. So because of the impairment of the skin, they tend to be exposed to many allergens, which may also exacerbate or worsen the condition. So we can now do certain tests like prick tests, patch tests, or even blood tests to just determine if they have allergies that could be making the condition worse. And then for fungal, we do skin scrapings. So ideally, clinically, like when you look at the lesion, you can tell, but because there could be other conditions that could mimic that condition, so we do what we call a skin scraping. So we scrape off some scales from the skin lesions, from the rash, and then these are seen under the microscope to look for any fungi in the fungal hyphae and spores in the in the specimen. For scabies, you just need also it's a clinical diagnosis, but with a dermatoscope, you can actually maybe see the mites or the pellets in the lesions, or even the burrows, because they tend to burrow into the skin.
Interesting. You're still watching Ask the Pediatrician, and of course today we have a dermatologist in the studio helping us understand various skin conditions that children tend to be prone to, and of course that are quite common in children. When we come back, we get our we take our attention to the text messages coming through. Remember, it's 0955 5070 0955 5070. You can simply send us a text, and I'm sure that my guest in the studio should be able to respond to that. Right about now, we take a very short break. We'll be back shortly.
Our plan is running smoothly.
My confusion is, how did it leave this table and found itself on your table?
I've just noticed you're a quiet guy.
Hey, bossy. Like the last time, you show your faces here. Otherwise,
I'm now spoiling our marriage. Based on us having children, that's me spoiling our marriage.
Finally, you got what you wanted, eh?
Do you know I can strangle you right now? Do you know what you've made me go through?
Your favorite music video show. In terms of music videos, we have the latest, the most trending, the most happening.
Zilile, man. Zilile. Remember, say I told you we're chilling with the prettiest and coolest girl on TV road. So stay glued to QTV, you know, log on.
The hour has begun to learn and have some fun with friends and everyone. Now, today, if you're bored at home, this is the perfect show to learn and how you grow. You grow. Make it your best moment today. Turn on set lights, cause we'll have to share wordings of fan we'll bring to you. It's Q Club. Q Club is the best for you and I. Lift your voice and raise your hand to sing wordings of fan we'll bring to you.
All right, so welcome back. Our topic of discussion today is common skin problems in children, and our main focus is eczema, ringworms, and of course scabies as well. If you have been a victim of scabies, how did you manage it? And of course I think this could be of interest, especially to those who might have a child who might have ringworms, scabies, fungal infections, and so on and so forth. 0955 5070 0955 5070. That's the text line that you're using today to obviously get in touch with us. Now, Doc, before I even get to the text message here, these skin problems that you have highlighted, do they have the same risk factors, or risk factors vary?
No, they are different things. There are different risk factors. And for instance, eczema, I mentioned having abnormal gene, the gene that I mentioned earlier, can increase the risk of developing eczema. And allergens can increase exacerbations. For fungal also, it's different, and the scabies as well. It's poor hygiene and certain times of the year, certain environments, crowded living conditions and things like that. So they are all different, and the approach is different.
Interesting. When you talk about allergens, do you also imply food allergens, or
Yes.
maybe any other?
It can be anything. It can be food, plants, dust. So these things in the environment, it can be food, it can be plants. So when someone is exposed to them, the body recognizes them as foreign, and then they develop an immune response against them. So sometimes that immune response is exaggerated, is leading to the allergies and things like that.
Our first text message says, what causes dry skin in children?
So dry skin is common in children with, it's much more common in children with eczema. Like I mentioned, these children will have, the most common thing that they will have is a mutation in a gene that produces a protein that helps to maintain the barrier function in the skin. So this barrier helps to prevent water loss. So if there are less and less of these proteins, then the skin tends to lose more moisture, and then it tends to dry up. Then after it dries up, it will have some small cracks, and then someone will have a very itchy skin because of that, and they may develop rash, which could be eczematus or something like that.
Our next text here says, how about pimples?
Pimples, so that's acne. Acne is more, usually begins at puberty. So the adolescents will be more prone to developing acne when someone reaches puberty because of the hormone changes that occur during that period. So there are hormones that increase the risk of developing acne. So mainly testosterone. So males have testosterone. Females also produce some amounts of testosterone. This one leads to increased activity of glands in the skin known as sebaceous glands. So these glands produce oil, and when the activity of these glands is increased and the ducts where the oil comes out is blocked, then they form this pimple. And then there are other factors that play a role as well, such as a bacteria which kind of colonizes that sebum plug, and then leads to more inflammation and things like that.
Good afternoon, doctor and presenter. I'm Zed. I'm from Kabwe. I have a son that has birthmark from birth on the forehead, and now is 7 years. Hair grows on this part joined to the head hair. Is there any solution to this? It seems like he has got a birthmark here, and when the hair is growing, it actually grows joining to obviously the hair on the head.
Okay, so there are many different types of birthmarks. So it depends. We need to have a look at the birthmark. If it's very small and limited, we can perform different procedures. Can perform cryotherapy, where we use liquid nitrogen to freeze the growth, kill the cells in the growth, and then it flattens out. And then there is in areas where they have laser, they can also use laser treatment to deal with the growth. So depends on the size, the location, and other factors. Then a decision can be made whether to do something about it and what mode of treatment what option to use.
What causes watery blisters on the skin?
Watery blisters. So there are so many conditions that can lead to blistering in the skin. There's a type of eczema called pompholyx, so that can cause some cysts on the hands, on the palms, and the soles. There are other immune conditions, the autoimmune diseases, such as pemphigus vulgaris or linear immunoglobulin A bullous disease in children. So this can also lead to a bullous condition. There are infections such as bullous in Paediatrician. So the causes are many. So we need to actually look at the individual patient, assess, and see what could be the underlying condition, and then treat based on that. So
interesting.
Yeah.
Let's come to the treatment of this condition. How is the treatment of these conditions?
Which
eczema, ringworms, and scabies. Maybe we can start with eczema itself.
Okay, eczema. So there are lifestyle modifications that the patient has to go through, and then there are now medical treatments. So on the lifestyle modifications, we advise on a number of factors. To start with, because of the drying of the skin, some long hot baths can lead to increased moisture loss from the skin. The skin will dry a bit more. So we advise on lukewarm baths, which shortened bath, less than 5 minutes duration. We also advise on wearing 100% cotton clothing, because a certain type of maybe wool, silk can increase the risk of developing eczema as well, like the flaring and all that can induce eczematous flares. And then we also advise parents to watch out for exacerbating factors, like maybe there are certain foods maybe the child may be allergic to, which is also increasing those increased flaring of the condition. And then when we come to medical treatments, we first of all, it's important to apply moisturizers. They are not medicines, but these are creams that prevent water loss and make the skin more moist, because these children will have dry skin, so they need to apply these moisturizers at least 3 to 4 times a day. They can just have one bath in a day, but apply moisturize the skin as much as possible, like as a supplement to the loss of the filaggrin. And then when they present with actual lesions, so we use certain creams to suppress the inflammation that's going on. So in the acute stage, we use like steroid creams, which within a few days the lesion usually respond well, but we can't use this for a long time because they have other side effects. So we incorporate other immune suppressing creams such as tacrolimus to just reduce on the inflammation for some time to maintain the
Interesting. There is an assumption that scabies are associated with bedwetting. Confirm?
No. It's not been scientifically associated. I mean, there's no studies to prove that there's that association. So it's not. The only thing is the children with scabies or even eczema sometimes may have poor performance at school, because in the night they'll have this itchy condition, they can't sleep well, so the next day at school they'll be tired, so they'll not be attentive, so their performance may be lower than others who don't have the conditions. However, there is no that association between bedwetting and scabies.
Help us understand the treatment for ringworms.
Ringworms, so as I said, it's a fungal infection, so usually we use antifungal drugs to treat. So you can use a systemic or oral tablets or syrup or something antifungal, or you can use creams. So creams we would recommend if someone just has one lesion somewhere, and then they can use that cream maybe about 2 times a day for some time to clear up. So there are many antifungal creams that are available. Then if they have extensive involvement, many lesions, we recommend oral antifungal drugs. So there is a drug called grisofavium which you frequently use, and it's quite favorable to use in children with favorable side effects are not so many, and it's the only thing is when taking that drug it has to be taken with food, because that improves the absorption of the drug. And then if they have lesions in the scalp, we also add on an antifungal shampoo maybe once or twice a week to just quickly clear the infection.
How long does the treatment for ringworms take?
So ideally about a month, because mainly because the skin takes about a month to renew itself. So the lowermost layer to reach the top and shed off, it's about 25 to 30 days. So we treat for a month to make sure that the skin has completely renewed. Because if you undertreat, then they will still redevelop the condition. The infection is still there, then they will still have
okay. So when treatment has been administered on a child, and let's say a child has got ringworms and of course he's on treatment, Any do's that you usually advise a parent to observe during that particular period? And what is the relationship between, ringworms and shaving of the head?
So I'll start with the first one. It's the parents, if they can make sure that the child is taking the medication, because sometimes they'll tell the child to take it themselves, but it's good that the parent may ensures that the medicine is being taken. If it's not being taken, they'll come back to us that the condition hasn't improved, but mainly because the child hasn't been taking it, or it has to be taken with food, like I said, with milk or just a meal. So that improves the absorption of the medicine. So if it's taken maybe other times, maybe it won't reach the desired site in adequate concentration, and that may be difficult. What was the second question?
My second question was, in most cases when a child is on treatment, especially with rabies, not rabies rather, but ringworms, you'd find that they are subjected to being shaved.
Mm-hmm.
Exactly. Any relationship? Is it automatic that when a child is on treatment has to be shaved for treatment to work?
No, there is no association with shaving.
Mm-hmm.
Maybe it's just a practice that maybe they may think it will help, but when the child is on a shampoo plus other antifungal, if you are just using a topical cream only, yes, it will be better to shave, because the cream has to be applied. It has to be applied on the desired side, because if there's hair, it won't really reach the site properly, or it won't be absorbed properly. But for like the ringworms affecting the scalp, they'll be multiple most of the time, and children will be put on oral antifungals in most cases, and then they will they'll also be on a shampoo. But if there's just one lesion and they prefer not to take oral medication, then probably shaving is the best, so that the medicine reaches its site.
When we look at the effectiveness of the medicine that is administered, which one seemed to be more effective? The one applied or the one taken orally?
The one taken orally.
The one taken orally.
Mm-hmm.
Oh, okay.
Mm-hmm.
Most of us thought the one applied is actually more effective, because since it's applied directly,
okay.
looks quite
No, the one taken orally, because the one applied, it might not it might not penetrate as much. Okay. So if you take orally, it will go from deep into it will cover everything.
Okay.
So it's much more effective.
I am a diabetic patient since 2010. Unfortunately, this year in September, my skin started some white spots on my arms, neck, and legs. Why was that? It's coming through from Adon Sesheke. Okay.
White spots depends on the type of diabetes that he has. But white spots, I'm assuming he might have vitiligo. Vitiligo is it's a skin condition. It's an autoimmune disease.
Mm-hmm.
Like type 1 diabetes is an autoimmune disease. And most of the time, patients who present with vitiligo are screened for diabetes and other autoimmune diseases, because they are at increased risk of these. There have been associations. So I'm assuming if he's a type 1 diabetic, then most likely he also has vitiligo, which involves the damage of the skin cells, of the cells that produce the melanin, the pigment in the skin. Mm-hmm. So these it's an autoimmune, so your own immune system targets and damages these cells. They stop producing this melanin, then you develop these white patches. So usually we treat it with topical immunosuppressing drugs.
Sometimes the ringworms are spotted on some people's skin who are HIV positive. What is the link?
The only thing is ringworms or tinea. It's called tinea. It may be more severe in patients who have HIV because of that damaged immune response or dysregulated immune response. So they may be much more severe and more extensive in HIV. But anyone with or without HIV can get the ringworms.
Let's talk about management of, or maybe before we even come to management, treatment of rabies.
Scabies.
Scabies, actually, exactly. How is it done? Some of us, the time that we got scabies, okay, Dettol was used. Exactly. Every time that you're bathing, definitely, you have to bath water that is mixed with Dettol and stuff like that. Quite itchy at the same time. Is that the treatment of scabies?
Okay, so the standard treatment, which is simple, straightforward, and very effective, there is use of the anti-helminthic, anti-scabies treatment. There's a cream called permethrin cream or lotion. So this is applied the whole body just once before someone goes to bed. They apply from the neck, because scabies will not affect the face and the scalp. To start from the neck going downwards. So they'll apply the whole body and sleep with this cream on the body overnight. Then they just wash it off the next day. So that's, and then just a once off. If they still have persisting things after a week, it can be repeated a week later, but it's just a once off treatment,
okay,
which is very effective. Yeah.
Good afternoon, Doc. I'm pregnant and in the third trimester. The problem is that I have started developing ilota on my back. Won't it affect the little one, and how can it be protected?
So ilota, I assume, is pityriasis versicolor, and it won't affect the baby. It's just in the skin. So it's just a purely skin condition which has no complications. It's just in the skin. It will not affect the baby at all. There are some creams that she can attempt. She can go to a health facility. They can prescribe some topical antifungal creams, and a certain shampoo which is very effective in treating this condition. And topical treatments are usually safe. There are those that we know we don't prescribe when someone is pregnant, but most of the topical creams, because of the less absorption into the body, are pretty much okay. But she needs to actually go to a health facility so they can look at it, and they can prescribe some topical antifungal creams.
In line with the lady's situation here, maybe something that I would also want to find out is, obviously, before a baby is born, there's a lot of preparations that parents usually do. Make sure that baby's creams are bought, baby's soap is bought, and so on and so forth, before they can even buy these things. To avoid complications of having these skin conditions, is it advisable that first of all they discuss it with a healthcare provider to see which one is okay, or maybe they can just go on and buy as long as it's a baby product?
They can discuss some. I'm not a pediatrician, but if there are certain products which they are going to use on the, I believe most of the baby products should be licensed for use, and they should be safe. It's not medications, it's just maybe creams. But if there are those that there are those that are commonly known and they've been used for a long time, but if maybe there's a new product, maybe they will need to, it would be advisable they just discuss the contents with the healthcare provider. But then there are those that are just, I think, straightforward. Yeah.
Finally, as we come to an end of our discussion, to the end of our discussion today, let us look at management of the three health conditions or skin conditions that we talked about.
Mm-hmm.
To start with, ringworms. How should it be managed? Especially, let's say a child is on treatment and maybe a child finishes treatment, to ensure that maybe there's nothing like reoccurrence. What are some of few things that maybe parents need to do?
Okay, so I can start with eczema.
Mm-hmm.
So eczema is a chronic condition. It's a chronic condition. It's there. we don't say we cure, but someone can go in remission. We can treat the episodes when they occur. The only things to pay attention is the lifestyle measures I mentioned earlier, to look out for maybe allergies that the child may have, which may be increasing the frequency of these flares. The baths, reduce the duration of the baths, put some oil in the bathing water if possible. Don't bath hot water, don't bath too frequently, at least once a day, and avoid this moisture loss. Then apply moisturizers. Once they maintain all that, it will be the recurrence rate will be low. For ringworms, it's a fungal infection. It will be treated with antifungals. They may still get in contact with other children at school who may still have the ringworms, or pets. So the pets also, they may contain this fungi and they may develop. So they just need to ensure just maybe the clothings are frequently washed and everything, the beddings and everything else. For scabies as well, it's direct contact. So if there's someone with scabies in the house, it might still be there even after treatment. So they need to wash all the beddings, the clothes in warm water. Make sure all the other household members also have their beddings and everything washed, so that you can get rid of that mite even after treating the patient.
Interesting. And finally, maybe just for the sake of the last text that we received there, this gentleman is trying to explain a situation where he goes to the barber shop, and after shaving his beard, when he comes back just a few days later, he notices some ringworms. So now his question is, can ringworms be contracted in this fashion?
So there is what we call tinea barber. So probably that's what he has. It comes after shaving, so it is possible. Maybe the machine that they're using was not probably disinfected properly, or there are certain cuts in the skin that have increased the penetration. They have opened up for the fungi to penetrate and cause that infection. So it is possible. So it just has to be treated with antifungals as well.
Well, Doc, thank you so much for coming through
All
today
right.
to help us really understand more on these skin conditions.
All right.
Hopefully that you'll be available next time when we knock at your office.
I will.
Thank you so
very
much.
Thank you.
All right, so ladies and gentlemen, that's all we have for you today. We're discussing common skin problems in children, and I'm sure that you have really benefited from the discussion. And in case there is somewhere where you feel you need private clarifications, feel free to visit your local health center. It could be your local hospital, your local clinic, and specifically meet a dermatologist. If you have got any skin condition, any skin problems, make sure that you meet a dermatologist, and will be able to provide the necessary help that you need. I've been your host, Nelson Zulu. Until next Sunday, it's bye-bye and God bless.